Hello everyone. Today I am going to demonstrate to you correction of facial sagging using Aptos Visage Excellence threads. These threads are 𝐀𝐻 threads, so the cogs lock on the undersurface of the skin, and that's how we use these threads to correct sagging of the face. These threads are made up of PLA PCl, which is something which remains in our body for 1.5 to 2 years and gradually it dissolves. So these threads don't cause any adverse events in the skin and the result will remain for 1.5 to 2 years. Let us see how thread lifting can correct facial sagging. So today we have a 40-year-old lady and her concern is about facial sagging. So when I analyze her face, I find that her laugh lines are prominent. Then when I see the face in 2/3 profile, I see that there is a little bit of sagging that she is developing here, which is called as a jowl. So how do we correct this kind of facial sagging is by putting the thread which is concealed inside the sideburn, so you can't even see the entry point of the thread. I am going to use 3 threads, one for the jowl, second for the corner of the mouth, and the third thread for her laugh line. So like an inverted W, when these 3 threads are pulled upward, they will give her very good correction of her facial sagging. So I am giving local anesthesia at the entry point. You'll just feel a little sore. That's it. I will also give local anesthesia at the distalmost point so that she does not feel pain when the thread reaches there. Entry point along the plane in which the thread is going to pass. Relax. So this is how the actual pack of a Visage Excellence looks. So let's open this and see. So inside this box of threads, you can see that there are 10 threads. Each of these threads is inside a cannula. There is an 18 gauge needle to make a puncture on the skin, and there is another cannula to give the local anesthesia. This we have already done. So let's see how these threads are inserted. So let us see how the threads are done. So I am just checking. Can you feel this needle? Nothing? So the entry point has become numb. Now from this entry point I am putting the first thread. So these threads travel very smoothly under the skin, and when I am passing the thread forward, I am pulling the skin upward, and that's how the skin hitches on to the under surface, and that's how the thread causes lifting of the skin. Then the thread is pulled upward and it is fixed to a higher location. So this was thread number 1. You can see instantly that this portion of the skin has gone up. Now I am putting the second thread, which will address the droopiness of the corner of the mouth. So the thread reaches till here, then it is pulled up and hitched to a higher location. So these threads are inserted like a V. So you go down, come back and insert, go down, come back and reinsert. So this was the second thread, and this is the final thread for her laugh line. So this will take care of the droopiness of the laugh line. So now I am going to give an upward pull on the threads so that the skin gets pulled upward, and then I am going to cut the threads off. So these threads are cut very flush with the skin, so there is no portion of the thread which remains on the outside. So let us make her sit up and you can compare both sides of her face. So now you can see that the face side which has been done up has good volume here. You see how flat her cheek is on this side, and how nice and rounded it is on that side. The laugh line, which is very deep on the undone side, and you see the laugh line on the right side, it is much less prominent, and you see how much sagging she had here. You can see that this jawline is now nice and tight and there is no sagging on this part of the face. So this is an instant treatment to get correction of facial sagging. So now when you compare the left and the right side, you will see that because of the threads, this side has got a nice volume because the cheek has got lifted up. Then whatever was the sagging in lower part of the face, this has also got nicely corrected. So this side looks younger than the other side now. So now we'll do the same threads for her left side. So you can see that now there is a good correction of the signs of facial aging. So there is good improvement in the lifting of her face. Of course, the face is swollen because of the local anesthesia. So the final effect you can see is after a week or 10 days after the threads. For a few days, the patient will feel little tightness on opening and closing her mouth. We will give her an ointment to apply at the entry points. Normally patients don't need any antibiotics or painkillers, maybe just a paracetamol in case there is any soreness. That's about it.